sphingolipids, okay, are a lot, which have a lot to do with exosomes, interestingly enough. The exosomes are made up of these glycolipid envelopes with a little bit of few proteins inside. Well, these are what's abnormal, significantly abnormal in people with chronic illness, because they are the signals that there's chronic inflammation in the bloodstream. See, because that is one of the problems of metabolomics, is we're looking again at the blood, when many times the dysfunction is in an organ. And so we're still looking at just the drainage from the system. And that's why a lot of signals get lost, because if it's your liver, or your kidneys that aren't doing so well, but the rest of the body is doing okay, if you're, obviously if you're measuring the end product of what the liver does specially or the kidney does specially, you can discriminate. But sometimes you can't tell when it's just a little dysfunctional, or maybe 20% of your liver is not working well. That's where the money is someday. Yeah, we're checking the whole system, but we can see patterns, and that's the important thing, the pattern of inflammation. And what's interesting is the patterns are similar enough amongst different symptom groups, like the Gulf War syndrome are significantly different from the Lyme people from the chronic fatigue people, okay? But they're all in that same ballpark. The sphingolipids are off, but they're off sometimes in slightly different ways. And what makes it even more interesting, okay, is that amongst the people, and I said we had about 40 metabolites that were abnormal, in the chronic fatigue group. And about, 25% had to do with having chronic fatigue, were shared. But 75% of the abnormalities were individual. Were based on that person's biochemistry, genetics, and environmental exposures.